share some data and background. Then Connor will jump in to share our Bedsider website. I'll come back to share some additional resources, and then Connor will finish up with some information about the Bedsider U program. So here's just a little bit about the national campaign. Our goal is to improve the lives and future prospects of children and families. Our strategy is to reduce unplanned pregnancy among teens and young adults. Why? There will be less poverty, more opportunities for young men and women to complete their education and achieve other life goals. We are a national, nonprofit, nonpartisan organization. From the beginning, we have been and will remain research-based. We focus on what works. As you can see from this slide, we work with a variety of partners, including with entertainment media, policymakers, and colleges and college students. We work with colleges because they serve an audience with a high incidence of unplanned pregnancies. And their interest in this is because a student who experiences an unplanned pregnancy while enrolled is less likely to complete their educational goals. I also want to mention that we focus exclusively on prevention, helping people avoid pregnancy in the first place until they are ready to be parents. And by this, I mean until they themselves say they're ready. We don't work on what happens once someone is pregnant, and this includes not working on abortion. This has helped us work with colleges that are in more conservative communities, including in Georgia, Mississippi, Arkansas, Oklahoma, and Texas. And as we like to say, if they can talk about preventing unplanned pregnancy in Mississippi, you can do this anywhere. So let's start off with a trivia question. And Teddy, I think you're going to jump in so that we can use the polling feature. So this is, sorry, Teddy, you jumping in? All right, poll is open, yeah. Great.
So the poll is open. The question is, what % of pregnancies to women ages 20 to 24 are unintended? So we're going to give you guys a few seconds to go ahead and answer. Sorry, Connor, go ahead.
No, that's fine. Go ahead.
Okay, cool. So yeah, we're just giving you guys a few seconds to go ahead and answer, and then we will close the poll and display the answers. So most of you have entered an answer. And can you see the results, Connor, or do I need to read them out?
Can you see it, Connor?
No, I cannot see the answers. It would be great if you could read them to us.
Okay, sure. So 7% of the audience selected 20%, 20% of the audience 50%, 38%, 55%, and 28% of the audience selected 81%.
Wow, interesting split there. So the answer is actually D. 81% of pregnancies to women 20 to 24 are unintended. It's actually the highest percent for any age group. All right. Great. So I'm sure I'm preaching to the choir with this slide, but why don't we want women to have unplanned pregnancies? Women having a birth following an unplanned pregnancy are less likely to have benefited from preconception care, to have optimal spacing between births, and to have been aware of their pregnancy early on, which makes it less likely that they will have engaged in healthy prenatal behavior or enrolled in prenatal care early in pregnancy. Women who choose to become pregnant, on the other hand, are better positioned to take advantage of preconception care and also are more likely to start prenatal care early in pregnancy. The capacity to plan and space pregnancies, which is typically achieved through the use of birth control, has significant and meaningful benefits for women and their babies. So who is having these unplanned pregnancies? The chart on the left is the percent of women who use birth control consistently, inconsistently, and not at all, or there were long gaps in use over the course of a year. On the right, we have the percent of unintended pregnancies that occur to these women. As you can see, the vast majority, 95%, of unintended pregnancies occur to women who were using birth control inconsistently or not at all. And women who use birth control carefully and consistently account for only 5% of all unplanned pregnancies. So moving women from not using a method or not using their method consistently to using contraception more effectively is an important way to make sure pregnancies are planned. Yeah. So what does this mean for the audience you are reaching out to? More than 8 in 10 community college students report that having a child while in school would make it harder to accomplish their goals, and 3/4 of them report that preventing pregnancy is important to them. For the vast majority, this is not a group actively trying to have children or additional children. However, we have found that many students lack the knowledge and resources necessary to use contraception effectively, and a third of these students said it was likely they would have sex without using birth control in the next 3 months. There's a wide gap between college students' aspirations and their behavior. So we're now going to present a resource that has been proven to reduce unplanned pregnancy and help women use a more effective method of contraception. So I will turn it over to my colleague, Connor.
All right, hello. So I'm here to talk to you about what is Bedsider and why does it exist? Well, actually, we've gone over most of those reasons with Chelsea, which is because, the 20 to 24 and even 20 to 29 age range is really vulnerable for unintended pregnancies. And when we first started researching this, we found that there were a ton of resources out there for teens, and that's amazing. Teen pregnancy is a huge issue. But no one was really talking about how to prevent pregnancies or unintended pregnancies for people in our age range. So we decided to create something, and it turned out to be pretty amazing. So Bedsider is, as we mentioned before, an online birth control resource for people 18 to 29. So Bedsider is, again, built for this age range, informative and medically accurate. Everything on our website, no matter how cheeky or sexy, is guaranteed to be medically accurate. It also promotes choosing the birth control method that works best for you. We really don't laud any method over any other method because it's all about you and your choices. You're going to be more likely to use the method consistently if you think it works for you and your body. And if you have all the information you need to make that choice, all the better. We're also nonpartisan and, of course, a program of the National Campaign to Prevent Teen and Unplanned Pregnancy. Bedsider is not political or government run. We are here to serve you and to help people in this age range be their best. We are not related to or paid for by pharmaceutical companies. While we do have all the methods available, well, not available, information on these methods available, we don't receive money from any of these companies. We just want to make sure that people have, again, all the information they need. We are not full of medical jargon. A lot of people, source out to the CDC websites, but they can be a little confusing sometimes. They're going to have a lot of stuff that I may have to go over in Google. And if you're really just trying to get that quick information to make your choice, not the best. So again, Bedsider is very easy to understand. Again, we're not biased towards any particular type of birth control. So we're going to go to a few of the resources that are available on Bedsider itself. And first is our kind of biggest and greatest is our Birth Control Method Explorer. Here you're able to see all of the birth control methods available in the United States. And it's way more than you think. Sometimes when you say the word birth control, the first thing that pops into people's minds is the pill and the condom. That's it. Sometimes even just the pill. But really, birth control means so many things, and not just hormonal birth control. It also means non-hormonal methods like natural family planning, condoms, tubal ligation, or being sterilized, and even the pull-out method. That is a method of birth control. And if anyone was curious, that is represented by the cork. It is a champagne cork. You better stop before you pop. The fun fact, we are having to change that because it wasn't quite clear from the picture alone, and we had been approached by a few of the providers that we work with saying that people were inserting corks. So yes, we are changing it.
We are responsive to the needs of our audiences.
Definitely. All right, and up at the top you're going to see a few of our filters. Again, most effective, party ready, which means these are methods that will be effective even if you are not of soundest mind. However we wish that people will enter into sexual relations with a sober mind. We are realists. That doesn't always happen. So harm reduction, STI prevention, hormone-free, easy to hide. I love this filter because, one, maybe someone is living in a situation where the people around them can't know that they're on birth control. These methods leave behind no outward evidence. Also for people who may be in abusive relationships where reproductive coercion is there. Again, this can help protect them and prevent unintended pregnancies. Okay, we're going to move on to the Method Explorer. So when you click on any of the methods on our larger page, you're going to go into this page with a lot more detail. You're going to learn details on, how much it costs, how to use that method, what are the possible side effects, and we cover both positive and negative side effects, because yes, there's a positive, more positives than just not having an unintended pregnancy. And of course, any problems or questions that other people have had in the past. And if you see there, we also have real stories. These are videos that we have gathered over the years of people talking about their very real experiences with these methods. So many times when you read about something, you don't quite get the full picture. What would your daily life be like on this birth control method? And you can watch them. They're really funny. We swear they are not scripted. Definitely true to life. All right. Then we have our method comparison tool. Up at the top, you're going to see icons that represent all of the different methods. Now, if you were on our website and you scroll over them, you're going to get actually like the word or like a label of what it is, which can be helpful. And along this axis, you're going to see all types of different things that may matter to people when choosing their method. It's not always, is this the most effective? You're going to assume that your birth control is effective, but does it prevent STIs? Is it hormone-free? Is it easy to hide? You know, what amount of effort goes into using this method? As much as, you know, the pill is very common, it actually is a lot of effort. Same time every day for possibly years. And for some people, that may just not be realistic. Maybe they're living really hectic lives, they're traveling, maybe you just misplace things a lot. It happens. Well, as a method like the implant that goes in the arm, you put it in your arm, or a doctor puts it in your arm, no DIY, and you're good for 3 years. You don't have to worry about a thing. As Billy Mays said, you set it and forget it until you have to get it removed and replaced. Moving on, or actually not quite. If you look over here, you're going to see you have an option to build your own. This whole thing can be a little overwhelming. If you're trying to make a choice, you can pick your 3 favorites and see a side-by-side comparison. Next, we have a brand new section to Bedsider, which is if birth control fails. All birth control methods, you know, they have different ranges of effectiveness, and this is where sometimes those unintended pregnancies can occur. 5%. 5%. Thank you, Chelsea. So now we cover information on parenting, adoption, and abortion. Mostly we do the bare facts, you know, what to consider, possible costs, a few more details on the different types available, and we point out to resources where you can possibly get help with whatever choice that you make. Next we have our ever so wonderful birth control clinic finder. I love this. It's as easy as entering in your zip code, and then all the clinics near you pop up with their name, location, contact information, and even their Yelp reviews, which I really like. I Yelp everything before I go. So this can be fabulous. We even on our page have a handy script that will kind of walk you through what to ask when you go, if you call any of these clinics. I, for one, freeze up when I call doctor's offices. That's why when my mom started making my dentist appointments, I didn't go for 7 years. I'm not proud of this. I went last month. I have no cavities. But yes, though, to be honest, this is great, but we have to realize that not everyone has access. I once did a walkthrough with someone who was from South Dakota, and they didn't have a clinic close to their house within 50 miles. So this is a really important thing to realize when we're talking to people. I don't know exactly where your campuses are, but knowing that, you know, there are, sometimes it's hard. All right, so next we have our fabulous, fabulous birth control reminder app. So many times, again, I was mentioning you had to take the pill every single day at the same exact time, and a lot of people have an alarm on their phone. But it's really easy to just turn off, just to make the sound go away, and then not take your medicine or birth control. I can say the word birth control. And so that's why we created our reminder system for the pill, the patch, the shot, and the ring. It's as easy as setting your time on our app. It's really user-friendly, and it will send you a push notification with a really fun message if you want. There's so many fun facts like this one. Macrophallus, a noun, an exceptionally large penis, could apply to an elephant or a boyfriend. Remember, any size penis can get you pregnant. However, if you're not quite into the macrophallus type of information, you can also get our more subtle reminders that don't even mention birth control at all. They can say, remember, wink. Easy as that. All right, so next we have articles. So Bedsider is not a static website. We are constantly writing about sex, love, relationships, and of course anything that's going on in the world of birth control. Recently, we posted an article that really kind of decodes that latest study that came out linking birth control pills and depression in young women. It's not as simple as a lot of the news stories set it out to be. So if you're interested in learning more about that, please do check out our articles page on bedsider.org. And then, I swear this is the last time you're hearing me talk for a little bit, we have questions. If you've had a question about birth control, you can bet that we have answered it. We have over 1,000 questions answered. And better yet, they have all been translated into Spanish as well, along with the core content of our website. So we do try to be accessible to as many people as we can. Right.
We also lately, I'll just jump in real quick, we also have the Guy's Guide to Birth Control, which is a really great resource for the male users on our site. Okay.
It takes two to make an unplanned baby.
It does.
All right, so we're going to pass it off to Teddy again for our next trivia question.
Okay, great. Just give me 1 second. Okay. So the next question you all should have received is, how many college couples are in long-distance relationships? Good question. All right, so get your answers in. Okay, so most of you have voted once again, so we're going to close it and read out the results. So 11% of you believe that 1 million college couples are in a long-distance relationship. 39% of you believe 2 million are. 50% of you believe 4 to 4.5 million, and nobody believes that there are 10 million college couples in long-distance relationships.
Wow.
All right, and the answer is B. 4 to 5 million college couples are in long-distance relationships. And I do have to wonder how many survived graduation. Mind you, actually, we're getting married in April.
Yeah. Mine did not.
Oh, no.
For the best. All right. So I'm going to switch gears for just a minute and encourage you to think big. Perhaps you're a student or a faculty member and you think your college could do more to help students with preventing unplanned pregnancies or with their sexual health more broadly. So I want to take just a moment to share what the national campaign can do for you. We have developed a framework that can help colleges convene a committee of faculty, staff, and students to prevent sexual violence, STIs, and unplanned pregnancies. The committee will take inventory of what's happening already on these issues when it comes to the college's policies, connecting students to sexual health services, and the education offered by faculty and by students, and making sure that everything is done in a way that meets the diverse needs of your student body. This will allow the committee to identify areas for improvement and where to focus the college's efforts. And then the national campaign can connect you to best practices and resources that would fit your needs. If you're interested in learning more about this framework, please do reach out to me. In my experience, sometimes there's a disconnect between what students want to hear and what faculty think is important or relevant. I sometimes hear faculty say that they don't think they should be talking about unplanned pregnancy because students aren't coming to them and saying that they think their college should be addressing it. However, I've heard this is an issue that is very real in the lives of students, and they greatly appreciate their college initiating this conversation because for many of them, it isn't one that they've had before. So students, you play an important role here. If you think this is an important issue that students at your college are facing, I encourage you to approach your faculty and administrators and tell them that students need to hear about this. I have also heard from colleges that this is a very personal issue and that it really isn't their business, which I totally understand, but in this case I would suggest mentioning that unplanned pregnancy can be a barrier to a student's ability to complete their education, so helping them prevent pregnancies is a retention strategy, and that is definitely their business. I encourage you to go on our national campaign website. It's bnc.org for all the resources we have for colleges, including some videos of students and faculty talking about unplanned pregnancy, how the topic can be included in an academic class such as English or statistics. how student clubs such as Phi Theta Kappa could take on the issue for a project, and much more. But I just want to speak for a minute about one specific resource, which is 3 online lessons we have developed for use in a variety of settings, including a first-year experience type of course or in an online orientation. And it's one that we would definitely consider a best practice. This could be used by all of you as continuing education about preventing unplanned pregnancy, just as an example. The online lessons are available on our website and are free to anyone who wishes to use them. The first lesson is all about why students should care about preventing unplanned pregnancy. The second is all about sex and birth control and draws heavily from the great content on Bedsider. And the third is about making a plan and taking action to prevent unplanned pregnancy. They're done at the student's own pace, but on average take about 30 minutes each to complete if they go through every one of the activities. They make a great homework assignment either for credit or for extra credit. We've also evaluated these online lessons, and after completing them, students were significantly more likely to believe a pregnancy would make it more difficult to achieve their educational goals, have a clear plan for preventing unplanned pregnancy, know where in the community to get birth control other than condoms, and believe it is realistic to expect a person to use birth control every time he or she has sex. Also, I just want to say students report that they really enjoyed and appreciated using the online lessons. So I encourage you all to check them out, and if you like them, share them as a resource with faculty at your college. All right, so something more fun for me. So each year we have an event that we call Thanks Birth Control, and this year it's just around the corner, Wednesday, November 16th. Thanks Birth Control is a social media campaign that asks everyone to publicly support birth control and everything it makes possible for individuals and society, including helping students stay in school. To do that, we're asking you to speak up, dispel myths, share facts, and mobilize your friends and colleagues to say Thanks Birth Control with us using the Thanks Birth Control hashtag that you see on the screen. As you can see from the photo, we have great t-shirts that are available on our website, and we also have a variety of digital postcards that you can share on social media. Colleges have done lots of different things to participate over the past couple of years, including having a sexual health event on the same day where they hand out condoms and brochures, post photos of themselves wearing the t-shirts on the college's social media page, and more. It's a great opportunity to get creative, and I encourage all students and faculty to participate if you like. There's all kinds of info about how to participate in the event on the Bedsider homepage, and we'll send around a link to everyone in a follow-up email as well. If you check out everything in the online store, you'll see that we have amazing Bedsider printed materials such as brochures, booklets, posters, and a few other things. You'll find that they are much more attractive and affordable than many of the other resources about birth control out there on the market. Finally, if you would like to receive discounted t-shirts, you can email me. Again, this is Chelsea, and I can try to arrange that for you. My email address will be at the end of the presentation. Just email me with what activities you commit to do on November 16th, and I can try to hook you up with a discount code. So with that, I'm going to give you my favorite trivia question. So Teddy, you can come back and poll the audience. But what is the world record for the most children born to a single woman? And the minimum is 39. So sit with that for a second.
So the poll question is up. You guys can begin voting now. Okay. All right, so we're going to go ahead and read out the results. 46% of you believe that the world record is 47 children born to a single woman. Second is 55. Third, with 19%, is 39. And 14% of you believe one woman gave birth to 69 babies.
Well, I have to tell you all that only 14% of you were correct. The answer is D, 69. So
Guinness Book of World Records certified.
Yep. And with that, I will give it back to Connor.
Yep. Look it up. It's a really interesting story. All right. So now I'm going to be talking to you guys about the program that is near and dear to my heart, which is Bedsider U, Bedsider's College Rep Program. so near and dear to my heart was actually I was part of their pilot when they first started it on only 4 campuses in the U.S. So I did it all the way through my college career, and I'm now here, and I run it, and I'm living the dream. So what is it? Bedsider U is bedsider.org's college-based peer-to-peer social marketing program. So by social marketing, we don't mean social media. Actually, our reps can't have social media for Bedsider U. What we mean is that we're really out here to promote behavior change or, increased knowledge. And our particular mission for our reps is to spread awareness of Bedsider's resources to your peers and ultimately reduce unintended pregnancy among our target audience. And further with this, we don't expect our reps specifically to be peer educators. Really, we want people to make people on their campus more aware of this resource that they can go to. Because managing 300 peer educators with one person in one office would be darned near impossible, even though I love that you guys are all peer educators. So what does a campus rep do? Again, you promote Bedsider on your campus to the target audience, coordinate and or sponsor events on and off campus, send students with questions about birth control to bedsider.org, collect student email addresses for our weekly newsletter called Frisky Fridays, which is just full of like the best fun snippets of information you could ever want. I think we have one coming out in the next 2 weeks about the history of the thong. Also, some more medical ones, but mostly just really fun. And then to communicate with other reps and Bedsider staff, which is me, on our rep website. And I'm going to go back to coordinating and or sponsoring events on and off campus, because this is something that I love, and which is the main job of a Bedsider U rep, is to kind of go to students where they are. I love me a health fair, but I was, again, a peer educator when I was in school and was required to be there and love them for that. But as much as we like that, sometimes students may not specifically seek those out. So my reps do things like this. Of course, we have tables, but we also have sponsored yoga sessions. We had an event where my Bedsider U group on their campus partnered with a local animal rescue and did fur babies, not real babies, and they did pet adoptions. Also, one group did a condom exchange where they took people's expired condoms, gave them fresh condoms, and then had a condom water balloon fight with the expired ones. Waste not, want not. But bad news there. Condoms don't like to break. Condoms also hold about 1.5 gallons of water. Condom water balloons turn into bludgeons and will knock a person down. Yeah.
Good to know.
Don't do that. Great picture, though. Great picture. So if you were interested in bringing Bedsider U to your campus, there's an easy step. All you need to do is go to this link right here at the bottom, and hopefully we'll be sending out a link to this to your email, which is all you have to do is fill an application on bedsider.org, and then the program coordinator, aka me, will contact you for a leadership interview. And I forgot to totally mention some of the perks of being a Bedsider U rep. One is that you are instantly connected to another national community, not unlike the one that you're already connected to with preconception peer educators. You are also given, every semester you get a swag pack of fabulous supplies, which includes paper info from all of like Bedsider's goodness. You also get close to 500 condoms per semester, t-shirts, stickers, tank tops, posters, fun little silicone ID wallets, because every student has a student ID right on the back of the phone. So handy. Also, sometimes sunglasses. Not every year. They're kind of a special treat. And then you also get to put Bedsider U rep on your resume. Always make a resume builder. All right, so that's enough from me. So we're going to finish things out with one more trivia question. We're going to let Teddy pull up those polling options. But the question is, how often does the average 18 to 25-year-old single guy wash his bed sheets? You may be surprised.
Really? This is how we end it?
Yep. All right, I will let Teddy read out the answers whenever he thinks you're ready.
I think we're ready. All right. All right, no, I'm going to give you guys 5 more seconds. Wow. Okay. All right. Yeah, okay. So I'm going to, yeah, okay. So how often does the average 18 to 25-year-old single guy wash his bed sheets? 3% say once a week, 19% say once a month, 32% say only when he plans on sleeping with someone, and a whopping 46% believe it happens at the turn of each season 4 times a year.
Well,
no confidence at all.
And you were good to have no confidence because 46% of you were correct. The average 18 to 25 single guy only washes his sheets on the turn of the seasons.
4 times a year.
4 times a year. Yeah. Get on that, guys.
Yeah. So if you thought that these trivia questions were fun, one of the things that we're going to follow up with after the presentation is a game that you can download that it has all different kinds of trivia questions, and so you could have some kind of trivia game, and it gives instructions for how you might do that as well. So that'll be in our follow-up materials.
And thank you guys for attending this webinar. We've had a great time presenting to you, and we are ready for any questions that you may have.
Great. So once again, if you have any questions, please use the questions box on your control panel. So we have our first question. It is in regards to the framing of large birth control. So they want to know why you frame the discussion the way you do, and more specifically, the inquirer says, I've noticed that the quote lasts up to X amount of years for LARCs doesn't always match FDA approval. So providers don't tell students anything more than what the FDA says is approved. How do you frame this discussion, and how did you come to the conclusion you did?
I'm not sure how to answer that, to be honest. I mean, we go with the FDA approved recommendations for that. And I'm not sure if there's any references on, like in the questions on Bedsider to off-label use is what I believe it's called. And I love that we have this website that we can look things up on it, because I do not propose to be an expert on this myself. But we do go with the FDA approved use for the different methods, and we do cover the differences between the IUDs, including the hormonal and non-hormonal ones. We do break those out. And then now there are the different time lengths for a couple of the different hormonal ones, and so we include information about that as well. Do you have something to add, Connor?
Yeah, I know that recently there has been talk about extending the length of effectiveness specifically for the implant from 3 years to 4 years. That may be what they're referring to. And again, I will reference that, you know, any information that we do put on bedsider.org is medically accurate. We would not put any dangerous information on there. If you would like for that person to answer that question, I can connect you with the person who does make those decisions, and hopefully they can answer that question more fully.
Mm-hmm. And if there's ever a change like that, like if it is ever finalized that a method would change its effectiveness time period, we would update that immediately on the website. It's a very, it is not a static website, as Connor said.
Great. Next question. If you don't take birth control at the same time every day, how does that increase your risk for pregnancy?
We have a really, really good article on bedsider.org on that called, hold on, let me look it up because I reference it so often, called Late for a Very Important Pill. And the thing is that there's actually so many different types of pills. You know, there's combination, which has both estrogen and progesterone, and the mini pill, which just has progestin. And, you know, those time periods, they differ as well. And if you do look up that article, Late for a Very Important Pill, it goes through what the consequences are of taking it between, you know, different amounts of hours out, along with, again, separating it between the two different types of pill. It's kind of way too much information to go into for a quick question, but again, all of it is right there for you if you need it.
And can you list the website again, please, one more time?
Oh, just
where they can find the article.
The article. Name of the article is Late, Late for a Very Important Pill.
On bedsider.org.
Yep.
Right.
And a good way to avoid that reminders app.
Yes. Right.
I'm totally not a shameless plug.
It's all good. So we have a question from a PPE. Do you all have any tips for how we can approach colleges with the Bedsider U information?
Of course, and I'm sorry that I didn't mention this more fully before. There are a few different ways that you can introduce Bedsider U to your campus. One is to integrate Bedsider U with an existing peer education system. So Bedsider U could kind of be an offshoot of PPE, where you just include Bedsider materials into your existing programming. Second is that Bedsider U could be an independent club that you do like you doing two peer education things, well, not peer education and Bedsider U. Or third, we do have a few Bedsider U campuses that are not affiliated with the school at all and are actually kind of completely rogue. Our mission really is to go peer-to-peer, so we don't always include the school's administration.
And as I sort of mentioned earlier, if going through your college and having some sort of approval process is really important for you if you want to bring this to your campus, definitely point out that unplanned pregnancies pose a barrier to a student's ability to complete their education. In my experience, there are always going to be faculty, perhaps maybe like a VP of Student Services or that kind of person that is really interacting with students on the ground, and they get why this is important to them. Some faculty and administrators don't have as much one-on-one with students, and so they may not see that this is an issue that they want to focus on. So for those other people at the college, it's really important that we point out that students who are not getting pregnant are more likely to complete their education. 60%, actually more than 60% of women who have children after enrolling in community college don't complete their education, which is 65% higher than for those who did not have a child after they had enrolled. So it definitely can be helpful to sort of make it relevant to them. So that's what I would recommend.
Next question is, do Bedsider U sites frequently partner with health clinics on campus?
Yeah, definitely. I already have a few health clinics partnering with my Bedsider U groups to do thanks birth control events. One specifically at Texas A&M, they're doing a Thanksgiving-themed thanks birth control event.
Nice.
There may be turkeys involved.
Great. And we have a question about getting more information on Bedsider U. And to do that, should they email you, Connor?
Yes. And we'll include some information about that in our follow-up email also that Teddy, you will be sending. We are very grateful for.
Yep, we will be sending a follow-up email with more information, as well as be on the lookout for a survey on this webinar as well in your emails. You should get that sometime tomorrow. The next question we have is, if you're on the same birth control for years, does it affect you having kids later in life?
No.
No, there's been no evidence.
Yes, there's been no evidence that taking hormonal birth control affects later fertility. I do want to reinforce right now, though, that we are not healthcare providers and we don't have medical training. So any information that we're giving, we have gotten from bedsider.org, which is medically accurate, though we may not be able to answer these more specific medical questions in maybe the complete way that people may be wanting.
Yeah.
But all the information is on Bedsider. And then we do have an article on that, and I will look it up.
And I believe that's one of the questions that we cover in the online lessons as well. We have a lot of quiz questions in there. Sort of we've learned that students don't always know everything that they think they do. They often are coming with a lot of misconceptions and myths that they've carried along with them. And so we've found that instead of saying, hey, you maybe don't know everything you need to about this, that actually showing them through quizzes and that kind of thing can be really, really helpful. So like I said, I definitely encourage you to check those out. There are definitely some sort of myths that we've heard, such as that one. Also, that some people don't realize that the pill can prevent certain types of cancer. We still hear, unfortunately, that some people think it's better to use 2 condoms than 1. So a lot of what the online lessons and Bedsider do is dispel those types of myths.
Yep, and I have pulled up the article that covers more in depth the fertility/infertility myths with birth control, and it's a pretty long title, but I'll read it out anyway. And it's on bedsider.org. It is Birth Control and Infertility. Does using birth control hurt my chances of getting pregnant later? ?
We have a couple more questions. Is there an available list of Bedsider locations?
Yes, it is on the info page for Bedsider U, which will be on in the emails being sent out.
Okay, and next question, how can PPEs participate in the social media event on November 16th?
I got that. So if you go again to bedsider.org, we have a lot of ways that you can participate. We, in fact, in addition to the t-shirts that Chelsea mentioned, have a series of digital postcards, which are really, really fun. So if you may not be able to get a t-shirt or feel uncomfortable sharing a selfie, these things are hilarious. They say things like, let me actually go to the page, that would be helpful. They say things like, the suspense, I'm sure, is killing you. Let's not make a baby. Fur babies now, real babies maybe later. 9 months from now, the only thing I'm expecting is to be more awesome. And just so you know, Thanks Birth Control Day isn't about baby bashing. Like, we love babies, we love families. And sometimes, you know, that you can thank birth control for even spacing your pregnancies. You know, I have this one baby right now, and I want to focus on this one baby or these 3 babies, however many babies you have. And you can say, another postcard says, you plus me plus baby makes 3, and that's enough for now. There are even a few gifts in there. Also, it's just a really good day to share, you know, what personally birth control made possible for you. I have talked to my Bedsider U reps about this, and I got so many answers. One was, you know, I was able to, you know, travel. Another one said that it really helped her. It actually saved her life. She was experiencing PMDD, which is premenstrual dysmorphic disorder, and had a lot of mental health symptoms associated with her cycle. And getting on birth control, specifically hormonal birth control, really helped her feel more like herself and be able to function more completely. So that's what made her thankful for birth control. And really, it's whatever means the most to you.
These are great questions. Thank you, everyone.
I have one last question. It's a pretty good question. So this student wants to know if you have resources for her and her boyfriend to look at together. So any couple-friendly items?
It's a great question. So we do have some really good print materials that I can recommend that we have available in the store, but really just going through the website together I think would be a great way to open up this conversation. We have some really great videos, like we've got the Guys Guide videos, which I mentioned earlier, that were developed with sort of a male audience in mind, but the women really like them too. I definitely appreciate the content on there. They're really hilarious. It features a young man named Guy, Not a Daddy, and he actually talks about the different methods that are available. Another sort of fun way to open up the conversation could be through our fact or fiction videos. They are animated, they're really cute. They start with a myth that we have actually heard before, and then after the little animation, then a doctor comes on and sets the record straight. And then perhaps you could jump into the Method Explorer, looking at what works, you know, for your lifestyle and fits what you want. I think that the Real Stories videos could be interesting as well. We have both male and female talking about the method, sort of talking about their past experience with other methods, maybe what they didn't like so much about those, and then what they do like about what they are currently using. So that's just a few different recommendations. I hope that's helpful. Connor, do you have anything to add? Good. All right.
Okay. Do you guys have time for one more question?
Of course. Shoot.
Okay, great. So how do you guys recommend getting more men involved?
Well, in our experience, at least in mine, I found that the men are most interested in this topic. From just based on like the evaluation that we've done of the online lessons, we've seen that they definitely start at a lower knowledge level than the females who have taken the online lessons. So they have sort of farther to go knowledge-wise. But we found that particularly the college-aged men are really engaged in this conversation. I don't know, do you want to add on that? I would not discount men as being not interested in this.
Yeah, I think it's really about being available to start the conversation and kind of being willing to answer some of the questions that might seem outlandish to someone who is really knowledgeable about the subject, but really when it comes from a place of sincere curiosity and not having a space where they feel comfortable asking can kind of create that illusion that they aren't interested. But really, maybe even if someone has a partner or maybe just some guy friends bringing up, oh yeah, I'm on birth control. This is like the different method that I'm on. Like what? There's so many different methods. Like we have a really great fold-out paper material from Bedsider that has our birth control method explorer with all the different pictures. That is really fun because it's kind of a shocker to some people. Like, wait, what's that? What is that? Is that a giant plastic sack? No, that's the female condom. But yes, so kind of, again, I would reinforce starting conversations and not being afraid to be that person who may start them.
Yeah, and we get that, most of the methods are for women. The guys sort of feel like, oh, my only option is a condom, but really they play a hugely important role in helping their female partners use the method that's going to work for them, which could be both condoms and some other method, but it really just depends on them, and that's a decision that men we have found are very engaged on.
All right. Well, thank you both, Chelsea and Connor. If you guys have any further questions or would like to get in touch with them, their contact information is on the screen. We would like to thank both of our guests for hosting today's webinar. It was really great information. Your questions were also great. So thank you all. Please check your emails again for the follow-up survey as well as more information from Chelsea and Connor. So we'd like to thank you guys again for attending the webinar, and this concludes today's webinar.
Thanks so much.
Thank you. It was fun.